it or not. Give me a second. Pop back in. I think it'll go back in. Let's see. Hopefully. Nope, it goes straight to there. All right. Are we good? We're back? We're back. Okay, you can see me? Excellent. Okay, because my other page jumps to another thing entirely. So, okay, good. Phew! On Periscope, excellent. It doesn't seem to matter. It seems to have more to do with the restream thing. So every time I try to get it to everybody, that ends up being the issue. Good Lord. But as long as we're up, I'm good. Okay, so so yeah, here we go. Let's be abundantly clear.
They're very smart, but they're very devious people, and
they're following me. They're in the trees. Look out. They're in the curtains behind you, thumb twiddler.
in many cases, very bad people, and in some cases, very good ones. There's a couple of good ones here.
Can we ask
What? What? Oh, wait, not again. Did it drop out again? Son of a bitch. It says, I don't know. All right. It seems to not, yeah. This is the weirdest thing. I apologize if it drops off for a second. It's just a very curious thing. Yeah, it's up on Twitch and everything. It's just the YouTube issue. Is YouTube being a jerk? Is that what's happening? Because I think it says online, so we'll see. All right, anyways. Who can say? Who can say? Go on. Okay, it's such a weird thing. I get all the things like a second after you guys do. So if it goes down, I hear like it comes back up on my side, and then I'm like, "Fish-you!" All right. Good Lord.
Please.
The man who was sleeping on the floor behind you, a question. Up until recently, we've heard a lot of stories of hardships from the front line owing to a shortage of PPE, masks, that sort of thing. Can you tell us?
Oh, yeah, there's nothing I can do.
Did it get bad where you were, and what's the situation now compared to what it was?
Sure, there's always a lag time between what happens in the real time versus when you guys get it. And
Tell me about it. I just had an internet problem.
So the PPE, the ventilator situation, yes, it got to a point where it was getting bad, but manufacturing ramped up. And I think those are two things that we knew we would take care of as a country. The third thing that we can't manufacture, and I've talked about this before, is a doctor or a nurse or essential personnel. We can't just manufacture them. So ultimately, that ended up being the weakest point for us on the front lines. We had the PPE, we had the ventilators in time, but we just didn't have enough people. We couldn't get them there fast enough.
And one of the things we did is we sent in the military doctors and nurses, and I think most of you have seen them, and some of you have worked with them. But they did a fantastic job. John, we had a lot
Fantastic job.
of the military, like we took the Comfort because they didn't need the ship.
No, it's like a pre-workout with like aminos in it. It's not really. It's just a non-stimulant pre-workout. It's good.
And we took the Comfort, and we took the doctors and nurses, and we sent them all over New York and New Jersey.
The doctors didn't come off the Comfort. You sent other staff. You don't even know where people are coming from.
We took
Yeah, I'm not drinking my own urine yet.
doctors and nurses out of the convention center, the Javits Convention Center, and many of them went throughout New York. So we did a job. And we weren't even supposed to have doctors in the convention center, but we ended up putting there. So we had a lot of, because it's true, what you're saying is right. The man and woman power was one of the toughest things.
Mr. Luke, and all of you, are you seeing now that the supplies are what they need to be?
Yeah.
I think it's sporadic. As I talk to my colleagues around the country, certainly there are pockets of areas where PPE is not ideal, but this is an unprecedented time. And the infection control measures that we learned
He's pissed about the question.
back when we went to school, 1 gown, 1 mask for
Just call them fake news. Don't even bother.
1 patient a day or per time. This is a different time. And I've been reusing my N95 mask for a few weeks now. I just broke out a new one to come here just in case I needed to wear it. To answer your question earlier,
She brought one to the White House. Like, I didn't even wear one at the place where they make the masks, lady.
we're all COVID-19 free. We were all tested, so we're not socially distancing, but we're all negative, and we wouldn't do anything to harm our president, obviously.
Everybody's been tested,
Yeah, we
Everybody's tested. I've been tested.
I hope the test works, right?
Nice.
We were all tested.
I hope the test works, right? Jesus.
We're all negative, and so that's why we're not socially distancing and why we're not wearing masks. Certainly, and I've had several tests throughout this whole COVID-19 crisis. I practice in New Orleans at a community health center. My youngest patient has been 4 days old, a 4-day-old infant. And
that's news to Trump right now.
so PPE has
there was I think a 6-week-old who died, and I want to say it was in Maryland.
Been sporadic, but it's been manageable, and we do what we have to do. We're nurses, and we learn to adapt and do whatever the best thing that we can do for our patients to get the job done and get the care provided, and that's what we're going to continue to do as COVID-19 continues.
Sporadic for you, but not sporadic for a lot of other people.
Oh, no,
Yeah, a lot of other people are getting more PPE than they, like friends of Jared, for example. Not, okay, if you're complaining, I can take your PPE away.
Mr. President.
Because I've heard the opposite. I've heard
Yeah, of course you have. Because it's Pence's job to blow sunshine up your ass.
they are loaded up with
I have not heard like this. How did you bring in this woman in here who's had to wear the same mask for weeks and weeks? Who didn't vet this woman?
gowns now, and initially we had nothing. We had empty cupboards. We had empty shelves. We had nothing.
Why were you president for 3.5 years before you even bothered to look at whether or not we were prepared for a bioweapon attack?
Because it wasn't put there by the
Because that's where all that stuff comes from, by the way, that there is used for, by the way. All the stuff in the strategic stockpile, that's why there are somewhere between 6 and 9 separate sites. They won't tell you because it's a military installation, effectively, to hold on to this stuff in case we get hit by, weaponized anthrax or something like that. We have masks and ventilators and all that kind of stuff to rush into areas in case they bomb New York with a dirty bomb of germs or whatnot. And, that's what it's for. And this guy sat for 3.5 years with supposedly an empty cupboard and didn't even bother to check. You could argue that, it was insanity that George W. Bush ignored the presidential daily brief that said Bin Laden determined to strike in in America. This dude ignored the same PDB for 3 years.
last administration. And I've heard that we have, I just saw it yesterday, where they're making millions of masks a month.
You were at a factory. That's not the stockpile. And those are being bought by states.
In a factory from, in that case it was Arizona. That's great. We have other
As opposed to, you mean overseas foreign masks?
factories being built now for masks.
Yeah, we paid for them. The taxpayers gave Honeywell 2 free factories. They'll never have to pay for. If you imagine yourself a business of any sort, and the government comes to you and goes, what do you, whatever your widget factory is, and you go, how many factories do you have? We have 1. We'll pay for 2 more, and you never have to pay us back. And we'll pay, we'll order stuff out of them for 5 years, so the staff can, and then, by the way, when this is done, you can convert it into making whatever you want to make.
And for the most part, that was fine, but I've heard we have
Too much.
tremendous supply. To almost
Look, don't let this lady, she's fake news. We brought her in here, but whoever brought her in is fired from the task force. I'm rotating them off.
all places. Tremendous supply. To a point where we're going to start having
Giving out ventilators to other countries, we know. Where are the tests? Where are the swabs?
Some of our-
Schwabs.
supply go to other
How are we going to make enough doses of remdesivir?
countries which need it very badly. How did you find that? You find a good supply? Huh?
I found that we had what we needed.
Good.
We had to change
Thank
the
you.
way we did things.
Thank you. See, they have plenty. Don't believe this wench over here.
You'll end up being a star.
And Mr. President, I just want to add one thing too. I'm a nursing supervisor where I work at. And one of the blessings I had is my director, my assistant director, his name is Dennis Hunter. he said, you know what, you guys take care of nursing. We'll make sure we have the supply. When we all talk about the fears, it makes it so much worse for us nurses to work. We're seeing the reality of it, but to hear it on constantly, there's not enough, there's not enough. In reality, I'm not seeing it. I'm in a hot zone right now. I'm in South New Jersey. All right, we're very close to New York.
And so you don't see that when you hear this.
No, because New York is buying all the stuff and giving it to New Jersey.
You know why? Because they're fake news, that's why.
Yeah, the woman next to you is fake news. She was lying.
I really appreciate you saying that. It's so nice that you stepped up, because they're fake news. No, when I took over, it's different. Now, I will say this, there was a period of time, but between Russia,
Yeah, because somebody called him out on it yesterday.
Russia, and all the stuff that these characters put us through, it's not so easy. And despite that,
You don't do this. The team in charge of the strategic stockpile, there was no aspect where the CDC or the NIH or even the Department of Defense were busy with Russia and Ukraine where they couldn't work on the stockpile. What is that? They don't even need, they interfered with it. They literally got into a spat with the people who do the repair work on, and the maintenance work on the ventilators we have in the stockpile, and lost the contract and didn't fix it, didn't get a new one. This is Alex Azar's job. There was no point where the HHS was like, I'm overwhelmed with Russia paperwork. We at Health and Human Services can't keep up. There are people doing these individual jobs. What are you talking about?
I've done more than any other president in history in the first 3 years as president.
And yet you managed to miss the only thing that would shut down the economy, cost us $6 trillion, and kill 70,000 Americans.
And you can look at that from any way you want to look at it.
I am. I'm looking at it from the point of view of someone who's living through a pandemic currently and has to stay home and not see his kid and his parents because of a disease spreading through the entire country. That's the perspective I'm looking through it. I'm looking at a guy who's saying the cupboards were bare 3.5 years into his presidency. At what point, if this hadn't happened, at what point would the cupboards have been replenished? If he got reelected and this hadn't happened, the ventilators we did have and the masks that we did have would have just rotted. They would have been even the minuscule amount left over that weren't unserviced or what have you would all be gone because he was ignoring all of it. And here's the thing, he's got an entire wing of the government and that's their job. Alex Azar, all the people at CDC, NIH, all those people, that's all they do. They weren't busy with Russia and Ukraine. They weren't busy with finding your taxes or fighting having to show them at all. That's all they do. And all they had to do was come in and go, Mr. President, we have a strategic stockpile of some elements or whatever, and in the budget coming up, we're going to need to ask to replenish them. They're below the numbers we think is necessary. To replenish those, we would need an infusion of about $200 million. We're going to ask Congress for that in our next appropriations meeting with them, and we just want to let you know. That's it. That's it. This is as much on Azar and arguably Fauci in that crowd, although I don't think he's in charge of the stockpile any more than anybody else is. I think if anything, he might be in charge of the elements where they keep a certain amount of anthrax related and flu related and Ebola related treatments available, drugs related in case there is an attack, a bioweapon version of this, or a pandemic that opens up on a smaller scale. That's maybe part of his job, but not the massive part, the militaristic part that would be him and HHS. This is ridiculous. 3.5 years this asshole has been president. At what time, if this didn't happen, everything that's in the stockpile, and not just the masks, not just the ventilators, not just the drugs that are in there, but every other aspect in the stockpile, the beds, the linens, it would have been moths and rat feces in the stockpile next year or the year after or whenever the next big thing hit. You can't be president and pretend this shit isn't going to happen, you punk. This is embarrassing. This is embarrassing. You should be embarrassed 3.5 years into your presidency to use the cupboards were bare as an excuse. This is pathetic. And if you support this man, explain the 3.5 years in. Explain that. Explain 3.5 years into his presidency, he's bitching that the cupboards were bare. You didn't even bother to look. You don't even, how do you move into an apartment? Do you even bother to look in the cabinets? We'll see what's in there. There must be food in the fridge. We'll wait till we're hungry to look. Jesus. What kind of an asshole starts digging a well when they're thirsty?
From rebuilding the military to cutting.
Thank you guys for the super chats. I got carried away on that, but this is
to getting rid of regulations at a level that nobody's ever come close.
Yeah, you prioritize getting rid of regulations, environmental regulations, things where you can poison the water, but you couldn't be bothered to check the strategic national stockpile in the event of a bioweapon attack, because it's the same stuff that's used if you like to be a wartime president. Well, you are the wartime president. You told the guys watching for Pearl Harbor to put down their binoculars and go home. That's what the pandemic response team is.
To saving your Second Amendment, which is under siege, by the way.
And did that take a lot of your time during the day? How is it under siege? How is it under siege? Because they don't want you to have 30-round clips? Because the only people who need those are people who are planning on killing cops and citizens in mass?
Right. So,
Christ.
But I really appreciate your statement.
I appreciate you saying it, not you for saying you had to use the same mask. Stop telling the truth around me.
It's really beautiful, and we
The
did.
issue of masks, I mean, I remember at the beginning of this crisis that you all were encouraging
right. We
people
didn't have enough.
not to wear them in order to have it for them.
You're right, but
So
that was
there
at the.
not enough at the beginning.
You're right, Jeff. And the reason that we did such a good job is because we were able. Now we have factories all over doing masks and building our own masks and doing them, because a lot of countries, I don't want to be specific, but they sent us masks which were total garbage and they were defective, and they sent us other equipment which was defective, and so now
Did they? What did we send to China? How about all the PPE we sent to China? How was that stuff?
we're building our own masks. We're doing our own masks. We're making them by the millions.
And the states are buying them from other countries.
And Honeywell in Arizona yesterday was a case in point, and that was some scene. I've never seen anything like it, and I didn't realize as they put different layers and then they put it.
Oh my God, he's back to, I don't even realize how hard it is to make a mask. If these other countries were making crap and mailing us crap, I didn't even realize how hard it was. Do you realize there's different sized particles? Jesus Christ.
Together, and each layer has a different function. I mean,
Yeah, you said that earlier, we know.
it's not just like taking a thing and wrapping it, as we said perhaps you can do in certain conditions, but certainly
It's not as simple as doing what I said. What?
not inside of a hospital. But no, we ended up, we had an empty cupboard and now we have full cupboards, and we have.
Yeah, in the middle of this whole thing, the state started buying their own stuff. You have full coverage because nobody wants anything that you have. They went and got their own.
Ventilators, and we have tremendous testing, and we're doing the antibodies very shortly, as you probably know. That's going to also mean,
Very shortly, that you need them before you open the country.
a lot of people that don't believe in such big testing.
No one thinks that. No one believes that we need. He means him. Remember that bullshit earlier about the only reason I have these tests is because, if we weren't testing, we wouldn't have such awful numbers. So
I mean, you have some people that want to test.
he is the only person against testing. For the same reason he didn't want to bring the people on board off the cruise ships initially. Screws my numbers.
Everything, 15 different ways. Mostly that's the media, because they know, certain things can't be done. But we have tremendous testing right now.
Oh, Kelly, I understand.
When you see that chart, I don't have it with me now. I guess they have it someplace in the room.
Go find the chart for me to show how many tests we have. Don't bring the per capita chart, whatever you do, and don't bring the cases and the deaths chart. at all.
But when you see the chart that I put up yesterday, as I was interviewed by one of your friends on ABC, that chart
That chart's amazing.
says it better than anything I can say. You
No, it doesn't. No, you could explain the per capita aspect of that
saw the
chart.
line going? We're like a rocket ship. Everyone else is down here.
Because they mitigated and they don't need to test as many people. Because they tracked and traced and they quarantined and they managed it. And they're on the downslope and we're still going up. Dummy.
Testing. And then all they do is complain about the testing. So look, you get
Some people don't even like testing. Testing sucks. Stupid
used to
testing.
that, but I really appreciate the fact that what you said. And we have great, and not only do we have great equipment, but we have the quality of what we have is far better than anything that we're getting, because we see what comes in. The quality of the gowns, the quality of the masks. We have, as of today, we got 1 billion gloves. 1 billion. Who ever heard of such a thing?
In the entire country, added on top, we use that many yearly anyways. It's a pandemic. Have you been to a grocery store parking lot recently? Have you seen the rubber gloves laying all over the goddamn place?
At the beginning, we had none.
We didn't have none. Good Lord.
You know, when this all started, we had none.
We didn't have none. We had lots.
It's one of the greatest mobilizations. It's a war, and it's one of
It's a war.
the greatest.
And I'm Captain Ahab of Warness.
It's been very successful.
President, one more question about reopening. The initial forecast showed that the real decline in the infection curve would be about June the 1st.
Yeah.
Latest forecasts have pushed that now back to August. And I'm wondering what the ramifications might be for certain reopenings, particularly schools, which begin to go back near the
Uh-huh. I don't believe that's going to happen. We got to open up. We got to open up our country.
I mean, I can
gotta get
just
back.
address one part of that. The school should open. The one thing you should be careful of is when instructors are over.
Older teachers. That's the argument you're going to make. Did you not hear her when she said her youngest patient was 4 days old with COVID?
60, especially.
When they're putting a 4-day-old in an incubator with oxygen. Oh
If they have a
God.
problem. That you should be, but the school should definitely open, in my opinion. Could you answer the other part, Deborah?
So I think you're referring to the model that looks at mortality.
We talked
Uh-huh.
about this.
And the mortality is very variable. That model has gone from 60,000 now to 134,000.
Yeah, it's gone from 60,000 to 134,000. And then, can you just flick that booger right on Alex Azar while you're at it? Oh my God. It's like, what a weird tell. You know, she's got post-nasal drip while she's talking about the fact that the death toll model has gone from 60 to 134,000 by August. And by the way, that's going to go up because of all the openings. Did you see this? I'm sure you guys saw this stuff this morning with Cuomo. But if you take New York's downward trend out of the national average, the rest of the country is going up.
Obviously, we track mortality very closely. You can see the rate of new hospitalizations has gone dramatically down. And
Because of New York. That's the only reason. The rate of hospitalizations in the rest of the country is continuing to rise.
so we're following that and mortality very closely. And so we all know about models, and that's why we follow the data metro by metro. And
And explain to Trump right now. Look at her looking at him right now. Like he's like, watch it, Deborah. I'll kick you off the task force before you know it. She knows that if you take New York out of the equation, it's going up.
you know, we have represented here New Orleans that has moved through a very large peak, and
Fauci's not anywhere to be found. They don't allow him within 50 yards of the president right now.
come down the other side. Same with Detroit. We continue to watch Chicago.
By the way, see that list in her hand? Okay, wait, see that list? Hang out. So that list is, let's see, where we go. Hold on, opening up a new web page. Here we go. I'll just go to just me for a second. So this is I have so many crazy. Hold on, we'll transition over here so you guys can find that the COVID death rate. Transition, you craziness. What's happening? Why are you not? Is there something weird going on? All right, it won't do it. Okay, so let's see. There we go. Well, now it's finally going. All right, there we go. We'll cut back to her in a second, but I want to find something real quick. COVID-19 death stats. So she's holding the chart in her hands. That, let's see if I can find it. It's the worldometer.info one. Yeah. So I'm going to bring that up in a second. So let me, ooh, that was fun. Hold on one second. I'll be right back up. Just transferring. Give me a second. Brio. They'll be back in just a moment. Give me a moment. So, done. Let's see. Let me bring this website up. This is so exciting. This is great production. Don't you love it? So let me open this guy up. Done. See if it'll pop up in that thing. 1 second. I have to find this site. It's very strange. Like when it tries to transition between pages, it does a weird thing. So give me 1 second. I'm with you guys. Okay, right. Let's see. Go back to here. Go to Brio. Done. So move this guy over here. You have to trust me on this one. This is so much fun. I just always have to. There's always something. For God's sake. For darn. There we go. So hi, how are you? Good to see you. So I'm trying to bring up this other page. Give me 1 second while I find it. But what she's holding is, if you want to look at it, one day I'll get a producer. Thank you, patrons. We'll get there one day. We're over 250. We broke that hump. Once we get to 500, we'll be able to get a producer. So let me transition to this, and then I want to go to the Safari task force. There we go. So we'll go to that case is one. Done. Transition. There we go. And then I don't think that Brio is above it, so hopefully it'll come up. It's very strange, this whole thing. Why this thing likes some pages and why it doesn't like others. But damn it, bring it up. Hold on. Give me 1 second, guys. I'm gonna make this happen. If it's driving me nuts. Well, I have a steering wheel where I got one. Come on. All right, we'll see if this brings this up real quick. Oh, there it is. Okay, so we'll drag her out real quick. And the transition, there we go. All right, so this is it. Let me see if now I have to see if it'll actually move. Sometimes it doesn't want to, but we'll hopefully do that. What she's holding in her arms, there it is. So that's what I was trying to find. That's what she's holding in her arms right there. So in this case, guys, we'll cut back to her in just 1 second. All right, here we go. See what she's holding in her arms right there? And I got to put this back here. On the fly. Look at that. Finding websites, solving problems, doing what I got to do. So what she's talking, while she's doing all this nonsense, for the record, what she's holding in her hands, if you see the red line right there, that red line, that's the new deaths. She's literally looking at that right now. Oh, and it goes away again. I hate when it does that. You crazy piece of software. Just play it, you jerk. So, yeah. So see that red line right there? That's new deaths. Look at that nonsense. And thank you, Christina F. So this is insanity. So while she's talking about the death chart and stuff, like she was showing this to the president before.
Very carefully. We know that both Boston and Philadelphia are still working through a very difficult time. So the country has moved as individuals.
Oh, are
and
they
what
now?
we are so proud about is how much the governors are using testing in a focused way. So they're not just
Yeah, are they now?
diagnosing the individuals that come to the hospital with symptoms. They're proactively going out and testing in nursing homes and prisons and testing everybody when they see one case in a meatpacking plant. And this is really allowing us insight. And we
Sorry if I missed anybody's the super chats were in there. Thank you guys so much. I'm you know, when I get in tech mode and I'm trying to solve things, it's a little it makes me a little crazy. I apologize.
appreciate the media calling out the asymptomatic spread because we've been talking about it for
Yeah, calling it out to Trump to get him to understand what the shit is going on.
2 months, but now finally it's really getting picked up that there is asymptomatic spread. And that's why governors using that strategic testing to ensure that the most vulnerable, those in disadvantaged areas of the cities, in multi-generational households, those in group housing, those in nursing homes, those in prisons, they're aggressively doing what we call surveillance and surveillance testing. And I think we've just been very proud to watch the governors pick up on the federal guidelines that called that out as a very key point.
Do you think we'll be in a place in August where schools, at least in some states, will be able to reopen?
Look at the eye blinking. No, the answer is no.
Well, again, it's a county by county, state by state decision, and that's how we're collecting data, and we're hoping, and we're asking all of the states to have a very, very great data system so that every community member.
They don't have the data to give an honest answer. That's what that is. By the way, I had to switch cameras, so that's why I'm weirdly pink. I blame LED lighting.
And see what's happening in their community, both with hospitalizations and testing, and unfortunately any mortality. So these decisions can be continuously updated. And
just the facts, ma'am.
We're seeing much better sites at the state and county level to really inform the public in a very.
So we don't have that info yet. So that's let me truncate that for you guys. She's saying we need more data to be able to answer that question. And oh, we buffered again. What the hell? All right. It says I'm getting great quality. Yeah, it's going through. So boy, it's so weird. Boo. That's the buffer tends to jump in like that. It's very strange. Yeah. Hopefully it goes back through. Yeah, no, yes, let me know. No, I just have very dark eyes. Sorry. It's buffering? Okay, sorry. Give me 1 second. Yeah, I'm always one, couple sentences behind you guys, whether it's, playing through, so. That's the buffer helping with it. Oy, so crazy. All right.